reason I say not yet, and why the Secretary of State Sajid Javid said that yesterday, is because we are seeing pressure in our hospitals. We've got a challenging winter coming. We see that every winter. If we didn't have a COVID pandemic, I suspect you'd have me on normally to talk about winter pressures in the NHS and flu. Now, we see that coming with COVID, with flu and a resurgence of flu and other seasonal infections. So we are seeing pressure in the system, but we're not seeing unsustainable pressure at the moment.
You know, just last week, we had a select committee report that showed that the government had watched and waited for far too long during the crisis of the pandemic from its onset. And here we are, a week later, doing exactly the same. And now just look at the figures. You know, we are seeing an increase in numbers of deaths of around 21%, cases 17%, hospitalization, again, about 17 or 18%. These are all figures heading in the wrong direction.
This is a perfect storm this winter. We've got reduced staffing levels, reduced staff morale, lack of equipment. We know that there's always winter pressures at this time of the year with the increase in flu and norovirus, which again is going to be more prevalent this year because we're now not doing the social distancing, hand washing, masks, etc. So to be honest, I begin to wonder if there really is a plan B.
I represent doctors, and what they're telling me, especially those in hospital, is that the pressures are really building up. We're seeing ambulances now queuing outside A&E, and it's not even the height of winter. So I'm not really sure what more we need to watch and wait for. Now is the time to put in place measures to reduce the spread of infection and, in fact, try and be a nation that can compare itself to what's going on in other parts of the world. You know, France has, you know, a tenth the number of cases, only 4,700 compared to nearly 50,000 here.
There could, apart from being a plan B, there could be a plan C, no mixing of households at Christmas time. Well,
I have to say I saw that story on my way over this morning. That's not something I'm aware of. I checked it out and I'm told there isn't. That is not a story with foundation. Of course, as a government, you look at, as we've done with our plan B, alternatives and ways that you might, if you needed to, start easing that pressure. But the specifics of that and what was mooted in it, as I understand it, because I only glanced at it, I'm afraid, on my way in this morning about sort of limiting household mixing, things like that, in a sense, going back, is that it isn't something that is being actively considered.